All right, I've been reading a really interesting book. It was recommended to me by a couple of friends. They're like, hey, check this out. It's called Outlive by Dr. Peter Attia. I believe that's how you pronounce his last name. That may be incorrect, not 100% sure. But the overall idea is very interesting. And he speaks of three major ages of medicine. If we go back to the ancient Greeks, there was sort of medicine 1.0, kind of do our best, bit of observation, inadequate treatments, but that was where the state of medicine was. And then through to maybe I think he's like 1850s or not, like there's a revolution in medicine that suddenly we have scientific method, we have antibiotics, we have the development of surgery, and he calls this medicine 2.0. And we've been extraordinarily effective at curing some diseases. Infectious diseases, not gone completely, but very, very much different to going back to before we had antibiotics. Surgery has been revolutionary for many diseases, but in the success of our ability to treat acute medicine, it has meant that people have lived a lot longer. And in that, suddenly we have opened up to the bane of current society, which is chronic disease. And he speaks of having watched people in their 70s, in their 80s, have an extended period of life, but their quality of life is very poor. That this acute medical system has bought time for these people, but typically it's a time of disability, a time of dementia, a time of relative pain and suffering that can actually go on for a lot longer than if we did not have the tools we have. Now, his point in all of this, he was actually a cancer surgeon. And so he went back and he's like looking at it all. It's like, okay, what we need to do is deal with chronic health, chronic illnesses. But these things, and he particularly references the four horsemen, the dementia, diabetes, heart disease, and cancer. So those, obviously there's many more chronic diseases as well, but nonetheless, that his insight was that the man having a heart attack at 68 years old did not develop that 1 hour ago, as opposed to an acute illness. If someone's in a car accident, if someone has pneumonia, then it might have been a couple of days, a couple of hours, but it's not going to be a decade or two. And he was like, well, it's very odd in medicine that when you hit the diagnosis, suddenly all the treatments begin for these chronic diseases. But before that, it's relatively non-specific. So far I've been into the book and he's referencing, okay, we've got a problem. We can't run a randomized controlled trial for these diseases because they're decades. I mean, we could, and it's probably worthwhile doing, but logistically it's going to be very demanding. And by the time that we get results, I'm going to be like, let's say in 20 years time, we work it out, then that puts me at 66 years old. I don't know however old you will be, add 20 years. And the time frames where you can take action will have passed. You see, the time frames to take action is now, for me, at 46. If you're younger than this, hey, great. But I often have my conversation with men under 40. I'm like, look, right now your major risks are from doing dumb things. That's what I call it, doing the dumb things. Just don't jump off buildings, don't drive cars too fast. But they're young men and they do that stuff. And I'm like, just be careful. But if you make it to 40, then beyond that, then you are faced with all of these long-term chronic disease risks. And I say to them, how you come into 40 will make a difference. Because if you come into 40 overweight, inflexible, never train, your mental health is a wreck, like that's going to be a significant amount of work to turn around versus coming into 40 in good shape. But after that, it's still an ongoing game of looking after yourself. And Peter is suggesting that it's small daily investments into decreasing risk that make a difference rather than one big thing like a surgery or the introduction of a pill. No. Now, he's got a couple of ideas around, well, where are we going to look? And one of them is centenarians, like these people that live a lot longer. And what was immediately interesting was he said there was no particularly common genes, or not quite. He did say there was two major genes that seem to be strongly correlated. One is this ApoE gene, and if you have two versions of the E4 variant, then your risk of Alzheimer's goes up significantly. And some people have said, well, I don't even want to know. But in reading the book, I was like, well, if I did happen to have two copies of E4, then I want to know that so I can be much more aggressive in the treatments that would be required to stave off Alzheimer's. I've just been through Alzheimer's with my father, or a variant of, most unpleasant, like just a terrible disease. Not so keen for that. I'm like, okay, how do I manage that risk? But I need to know what the risk is. Do I have the risk before I can manage it? The second one was a set of like genes called FOXO3, and these appear to be like senior management. We'll call them senior management. They're not actually doing the work, but they organize the work to be done. And the outcome was that a lot of these centenarians appeared to have bodies and minds that were more equivalent with people 30 years younger than them. So at 60, they've got a body and mind of a 30-year-old. At 80, they've got a body and mind of a 50-year-old. At 100, they're starting to run into what we normally see at 70 and 80. So this is worth studying. And he's like, okay, this is one of the areas. So I've been reading about the centenarians and what we can learn from there. And then he's got 4 more ways of studying. The only one that comes to mind right now is an interesting one called Mendelian regression, I think it was. And it was like, okay, we're going to naturally look at the natural occurrence of genes and see what happens. And it's not an experiment, but it is looking at the data and extracting out the data. So I feel like this is a very interesting area that we are going into. And one of the insights that I've had is that our medical systems are very much set up for acute medicine, medicine 2.0 in Peter's words. But medicine 3.0 is a different kettle of fish because of the long-term nature and the requirement to look at data over extended periods, as well as organization for what needs to be done. This is looking a whole lot more like project management. So we'll see how this plays out. I'm going to finish the book, extract out what his recommendations are, and then see what we can do. Like what needs to be done with this new information. One of my friends has been heavily into nutritional medicine, so I'm asking him, is this the sort of stuff he's been into? But very curious around what can be done. Certainly from my own point of view, hey, at 46 years old, having just witnessed my father's ill health, how do I avoid that? But also for our patients. We are clearly able to solve acute medical conditions very well, but we've been quite poor at dealing with these chronic health conditions. All right, that's all I got for you. I will keep you informed as I go through this book, and I do feel like it is something that if this can be well managed, then the value of this is significant. To be able to avoid cancer, avoid heart disease, avoid dementia, avoid diabetes, that this is something that is of significant value, particularly because when you have any of those things, the quality of life tends to go right down really quickly. All right, that's all I got for you. I hope you have an awesome day. Catch you next time.